Today we are going to comment about plastic surgery. Plastic surgery. They call it plastic because it is elastic. It's just elastic like plastic, which you can mold in this way and that way. There are majorly two types of plastic surgery. There is the elective and there is the medical plastic surgery. Elective is when you choose to have a plastic surgery, and the medical is the one that an incident has happened and your face or body is disfigured. Then they make a different molding to represent as much a normal body as possible. Some people get accidents, be it fire, mostly fire, or even you could be attacked by crooks, or you could enter into a situation where you get an accident and your flesh is cut into pieces, such that when you meet somebody, you look like Ken of the WWE. Remember, Ken of WWE, when he started fighting, he used to put on a mask for a very simple reason that he did not like the way he looked. But later on, he gained confidence and accepted his body the way it is. My issue mostly is to do with elective plastic surgery. If it is a medical and it goes wrong, then that is how it is. You may even have any operation, and in the course of operation, you die. It is because they are trying to treat you. But elective is where you want to look slightly different from what you are now, or even a greatly different. You may choose to resemble a prominent person, or you may choose to look younger, or you may choose to have a different skin color. Most of this plastic surgery is targeted at the face. Most of this is targeted at the face. We have some cases, I said most of them are medical, others are choice. But then we even have some which are medical, but somebody has a choice. A person like the late Michael Jackson. Michael Jackson had an accident. You see, during my time, we had a hairstyle called afro. It is still there, but nowadays, apart from Kasamuel, Macro, you will hardly find a man with afro. During the time when I was at the age of Kasamuel Macro, we used to like that hairstyle, the afro hairstyle. Michael Jackson had that, but he used to apply a lot of what do you call jelly on his hair. So when he was playing around with fireworks for a Pepsi Cola advertisement promotional, the fire lit and burned his head. Now this is the occasion when he had a medical surgery, medical plastic surgery. But he combined it also with elective. He had three problems. Actually, the problem with Michael Jackson is that he never shared his problems with people. And if he would have shared his problem with people, maybe he would even still be alive today. He had three different issues. The first one was the burnt face. Second one, there are some aspects of his face that since his childhood he did not like. So he used this opportunity of a medical performance, then he combined it with a selective. Remember I said we have two types, selective and medical. But then we have few cases like his where it is medical and you choose. He did not like his nose because he believed his father used to mock him about the nose. I know about that. My mother had two brothers, so I have two jombas. One who recently died was very black, and the other one who is still alive was as brown as Taitas. One was as black as a Luo, and the other one uh, was as clear as Taitas. And you see, the uncle who looked like a Taita had taken it from my grandmother, and the black one had taken over from my grandfather. But whenever my grandfather had issues with my uncle, he would tell him, watoto wangu wote ni brown, wewe ni mweusi. But you see, that uncle looked like him, and that blackness was his. So Michael Jackson also had that issue where his father used to mock him about large nose. So since childhood, he hated a big nose. So he decided after that Pepsi Cola issue, he decided to make his nose. It is alleged that some people known, but ladies, Michael Jackson used to admire their noses. So he insisted that his nose be made like those ones. The third thing, because I said the first one was he had an accident with the fireworks, and then second he chose, and third, I don't know whether it was because of the fireworks or anything, he developed albinism. It is a rare case because most of the people who are born, they are born with albinism, but I think that one must have provoked that. So that is that. So we have those types of people, but I would tell people, especially, I think 98% of people, especially Kenyans, who go for corrective surgery, which is also called a plastic, usually are women. Now, my fellow sisters, whether you are going for medical or non-medical purpose, first of all, I would discourage you. I would discourage you from going for a selective uh, plastic surgery. Let it be medical, because I don't know how to explain about this thing called self-help. If Simbo Steve is comfortable with his looks, why are you concerned about that? And you see, if you look at Michael Jackson and you are very sincere with yourself, I think Michael Jackson was more handsome than when he was operated. Although we agree that his operation was necessitated by the firework. Another thing that many women, especially those of a higher pocket, they go to a clinic and they want to remove fat. They want to remove fat. So if you cannot remove your fat through morning run, forget about it. Just buy a juala every day at 3 a.m. Make a run. You'll lose the fat. But this thing of them drawing, you go to a medical facility, wanakuchora chora kwa uso kama choka with a felt pen. Now you are you're trying to change God's look. Is there any person who knows how to make beautiful people than God? And then these places we go, if truly, because I know hospitals like Kenyatta National Hospital or whatever, they allow their facilities to be used by people who are trained. I remember somebody went to Nairobi Hospital, but he could not afford Nairobi Hospital. So he was transferred across the road to Kenyatta National Hospital. And the doctor who was treating him from Nairobi Hospital would cross over and come and operate on him. If you look at many of these, facilities, you'll find that they are licensed, and they even indicate that they don't show that it is a major operation. There is a lady who died recently, and I didn't want to mention her. If from what I know, she died, she must have felt that she has a lot of fat on her tummy. So for fat to be removed, they have to, wanakata tu kama vile butchery wanakata nyama. Two, the intestine. They reduce it. Remember, whether you are as huge as Yokozuna or as small as Emoro, the length of your intestine is roughly the same. Or some even go to an extent that you see, fat people, the stomach is larger than an ordinary person. Why? Because the amount of food that person eats mostly is more than what we others eat. Now, what the people do is that they cut your stomach into a fraction. Let's say they can make your stomach be 80% of what it is. They can make it 50% or even 60. Now they cut off na wanashona, so that when you are eating and you eat half of what you usually eat, the stomach is already full. Now, in the case of this lady, what happened is that these people were not as experienced as they are supposed to be. Remember the bus that you use. The driver has over 20 years experience, isn't it? But remember, there was a time he had only 2 months experience. And where did he get the experience? He got it from those buses. And human beings, for someone to be operating people and have 35 years experience, at least one time he started with patient number one. So in this case, the lady was being handled by a team that was not as experienced as it is supposed to be. And experience is supposed to be two-way. There is one who's just entering the trade, and then there is another one who has been performing it for ages. Now, so that they transfer the knowledge. But this one, it seems that they were all of them were not that experienced. And what happened was that when they are operating, it's just they operate like sewing of clothes. Now they used walitumia sindano zile kubwa kubwa, which left holes there, and so in her normal functioning of food, in the small intestine, when things reach small intestine or anything just from the mouth downward, if it gets it gets a place and it goes through, it even tears that place. And again, for you to perform such a serious experience, if to do such a serious issue, your facility is supposed to be a 24/7. Remember this one, it reaches evening and they tell the patient, you go home, it's closing time. The only place that they are supposed to do that is minor surgery. Now she even insisted on staying there longer. She insisted on staying there longer for a day more. And look at, as we finish off, look at the license that they were given. It doesn't include opening up somebody. But you see, pesa. So we can jail them, but others will come. The only way we can stop them is by telling people that unless it is, you see, there are some people who have an accident, they get burned, or they get a road accident where the body, you would even think that this is somebody from a horror movie. Such people, let us accept. We even have some people where a skin is removed from a hidden part to be placed on your face so as at least you look presentable. Let us agree that those are the only cases we should agree. This thing of elective surgery, let this one be the end. Thank you.